Blaring sirens help ambulances carry patients at top speed to the hospital. It's not helpful then if once they arrive, patients and the paramedics treating them are stuck in lineups waiting for care. Justin Chandler covers the Hamilton-Niagara region for Ontario Hubs. He's been looking into why that's reaching troubling levels in St. Catharines and other Ontario health regions. Hey, Justin.
Hey there.
All right, so for your latest article on tvo.org, you talk a lot about offload delays. What exactly is that?
So, an offload is the process that paramedics and hospital staff go through when care for the patient is transferred between those two groups. So, once a patient has been registered and is under hospital care and off an EMS stretcher, they've been offloaded. So, the provincial standard for that ever since 2007 has been 30 minutes. If the process takes longer, as is frequently the case, especially now, that is considered an offloading delay.
All right, so why is this such a problem in the Niagara region, specifically St. Catharines, but we're also seeing it in other parts of the province as well, correct?
Yes, they would say this is actually happening all throughout the province, paramedics are saying. So, in the Niagara region, some of the things that have been cited are hospitals getting back into regular operations. And this has meant that all the people who had delayed things or people who maybe had health problems and those problems are now worse because they weren't getting hospital care during pandemic closures when hospitals were more focused on COVID and had paused certain operations, just mean that there's a significantly higher level of demand. And that coupled with staff burnout in hospitals and at paramedics, that's just meant that there's fewer people available. And then there's just the continuation of hospital bed shortages, which has been a problem in the province for years.
Well, let's talk about that. We've talked about hallway medicine for quite a while. What exactly are you hearing from experts in the hospitals talking about sort of the ripple effect from bed shortages to these offload delays?
Well, one of the things that they're saying is that really hospitals are just running out of places to put people. So, because potentially there's not enough long term care spaces, or because there are too few community paramedic programs that can treat people outside of hospitals, hospital beds end up getting taken up by people who maybe don't actually need hospital level care, but need to be cared for somewhere. And so they end up in hospitals. And that just means that there are fewer places that incoming patients can actually be moved to in an expeditious amount of time.
I think there's one thing a lot of people don't think about is, once you call the paramedics, the ambulance comes, gets you on the stretcher, gets you to the hospital, and then they're waiting there. This actually ties up sort of resources for other calls as well. What's sort of the shortage in terms of ambulances for other calls? Have we been seeing some stories on that as well?
Yeah, this is a big concern, and it's something that. So, for example, Niagara EMS, the chief there, Kevin Smith, he said that this is actually a crisis because not only are people waiting so long, but when these ambulances are tied up, it means that there's not other ambulances available for calls. So this can even mean that in some cases there might not be any ambulances available for calls. And Hamilton has logged that in the last several months that's been happening. So really, it's sort of this problem where it hits us from multiple ends. So not only are patients waiting in hospitals sometimes for hours for care, but then those paramedics are also there, and they're not on duty being able to respond. Well, they are on duty, but they're not in their same capacity where they can just go out to a call. And so it means that then people who are trying to get help are waiting longer too.
On that point, I'm curious, are patients getting care when they are still waiting for beds, say if they're in the ambulance or sort of just ready to be offloaded into the hospital?
Yes, the paramedic leaders that I've talked to have said that yes, paramedics are trained to do a high level of care and they're going to do the best that they can, but they don't do hospital care. So there's some things here that can be a little tricky. So paramedics won't have permission necessarily to give patients food. So, like in the past 7 months in Niagara, before my article came out, about 350 people waited 4 to 6 hours for care.
Hmm.
So, in that 4 to 6 hours, you could get hungry. Maybe you've got to go pee. And so, the paramedics are going to have to be talking to hospital staff, trying to figure out, okay, this patient that we've got here, is it okay if we feed them? They've got to negotiate whether they can give them that sort of care because there's only so many things that they're legally allowed to do in that time frame.
4 to 6 hours, that's quite a long time. I am curious, are we seeing an increase in, say, more serious health issues or, say, fatalities because of sort of these offset delays?
This is a little bit trickier. The paramedic services have said that if people are in life-threatening conditions, in Hamilton, for example, that's just about 10% of EMS transfers to hospital, that you're much less likely to wait. But I also had it said that, it could happen that someone is in serious need and does end up waiting longer. It's more likely, though, that someone who's in a less life-threatening condition, but still needs hospital care would be the sort of person who's waiting.
Now, earlier this year, I actually spoke to a couple of paramedics, and they were explaining sort of the day-to-day struggles that they had, where they would go through a 12-hour shift and not have a lunch break, or they wouldn't have a chance to go to the washroom because they have to be beside their patient as they wait. I'm curious, what have you been hearing from paramedics in terms of the impact it's had on their health?
Yeah, Chief Smith in Niagara was saying that this has definitely been something that's contributing to staff burnout, and to increase sick pay usage. So, for example, the average offload delay recently has been 90 minutes, and what I'm hearing that means for paramedics is that they're going to be going right back out shortly after being in the hospital. They're lacking that time that they can decompress. And they've said that from April to August this year in Niagara, sick time has been up 33%, which equates to about $121,000. So this is a problem that ends up costing a lot of money too. As you can even look as this time that everyone's spending in hospital in Niagara right now, it's forecast that by the end of the year, that's going to be about $20,000. The service is saying that that's over $2 million in lost time.
Speaking of money, we know earlier this week the province announced that they would be expanding one of the hospitals in the Peel region. But I'm curious, are health regions or the Ontario government doing anything to address this specific issue, knowing that there are some ripple effects as well with bed shortages and such, but to this specific issue?
Yes, there are different things. So the Ontario government, for example, they've said that they've done work to try and increase how paramedics can treat people in the community without taking them to hospital. They've also provided in some areas funding for nurses to help with offloading. And this is something that paramedics and hospitals are working together on, just trying to find any sort of way that they can make things go faster. So some examples that I've heard, things that are in discussion, could be, for example, maybe nursing students helping offload patients instead of that just being a regular nurse, or maybe changing it so that it's not paramedics who are transferring people in between hospitals. But people are looking for all sorts of ways that we can save a little bit of time, because although, yes, this is a big systemic issue, those things take time to fix, and there's problems now, and it sounds like people want to come up with some creative solutions.
Well, we'll look forward to that. I really appreciate it. Justin, thank you so much for this.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.